Hello, good morning, Andrew. Good morning. We can hear you very well. So, ladies and gentlemen, I'm very happy to introduce to you Andrew Thompson, who is a managing director of Spring Ridge Ventures and also associate of Creative Destruction Lab at the Oxford University. And you were just recently in Australia as well, so we met 2 weeks ago, was it that long? Yes. And actually, I really, really like your title. Sick care is great, but now let's build healthcare. So, let me ask you to just elaborate on your title.
What I mean here is that we have a system that we built in the last century to deal with the problems that we had mainly at that time, which were acute disease and trauma. Yeah. And it was built on a model that was invented in the last century, which was centered around professionals. Yeah. Doesn't do a good job of dealing with the big issues we have today, which are chronic non-communicable diseases. So we need a new kind of solution, and we should build it with the best technologies we have today, and we should use the model that is most productive today, which is to center not on professionals but on the consumer themselves.
Yeah. Okay, thank you very much. And we have pre-recorded the video with you, so let us watch the video first and then take questions and answers, yes?
Great, okay.
Okay, let's do that. Sorry, we don't have a video with sound. Something is damaged there, so we have a technical issue. Andrew, can you hear me now?
Yes, I can hear you.
Okay, so maybe we can just continue live. Actually, it's a situation that live communication is better than pre-recorded video, right? So, fantastic. Yeah. And I think it is actually characteristic to you as well, because as much as I know of you, very shortly we have met, then you are an entrepreneur kind of trying to change the existing structures of health industry. Is that right?
Yeah, so I spent 30 years in Silicon Valley starting and building what I call technology-based healthcare companies. I've worked in biotech, medical devices, pharmaceuticals, digital health, a lot of different things, and everything that I've done has been about first-in-class, new kinds of products that change the way the world works. I'll give you a couple of examples. So the first company I helped start, wrote a business plan for in 1989, was a company called Genesis. It was one of the very first biotechs to use a homologous recombinant technique to up and down regulate genes. And so, obviously people now talk about CRISPR, but this is the beginning of those kinds of technologies, and that was in 1989. I started a company that was the first company to do minimally invasive surgery inside the heart, avoiding opening the chest and opening the sternum using tools that went through the arm and the groin. That company was sold to Medtronic in 1993. So these examples of very early innovations that were groundbreaking in terms of the direction in which they took clinical medicine.
Yeah. So if you think about, maybe it's very common to you to kind of see how the medical industry is developing and how the new ventures are created and being part of the venture creation process yourself. So we see now that our expenditure on health totally all over the world have grown and achieved like a peak level of, 10% from global GDP, right? So it means that the technologies and new business models are really delivering to people the solutions and giving hope in situations like cancer treatment or also mental issues or things like that. What are the main fields or what are the main technologies that you see that are most promising ones for private business models?
So I think it's very important to point out that this growth in healthcare spending doesn't necessarily mean that we're getting the right therapies to the right people at the right time. Yeah. What the industry has become quite good at is getting the right products to the right reimburser or insurance payer at the right time so that they get rich without necessarily patients getting well. And so there's a very significant issue that relates to how you pull what I'm going to call the patient outcome lever as opposed to pulling the corporate profit lever. And so that then leads to a very important shift in the way in which we think about the business model. The 20th century business model is based around buildings, people, products, and professionals. Mm-hmm. And the 21st century business model is going to be based around mobile, software, service, and consumer. And that's a very different way of operating, and it's a very different way of driving how money changes hands. What we know is that it's very difficult to get 20th century businesses to adopt 21st century business models. And so if you just think about e-commerce or media, you don't go to a bookstore to see a clerk, you get a novel, you use an iPad and software, and you download content. There's no building, there's no person, there's no product. You don't go to a bank to see a teller to get money, and you don't go to a checking desk to see a clerk to get a boarding pass. All of this is done on a mobile phone. It's worth noting that big traditional retailers will still go bankrupt, not because it's not obvious what they should do, but because it's almost impossible to get the people inside those enterprises to change what they do. And that's going to be the really big challenge in our sick care system. And so this is why I say, let's keep sick care, leave it the way it is. Let's not keep feeding that beast. Because actually the way to help patients is not to treat cancer in late stage when you spend a fortune on drugs that mainly don't work. The main way to help people with cancer is to help them with their lifestyles well before they have tumors. And so we've got to build a healthcare system that's much more focused on prevention and wellness, and that's much more focused on the consumer. And those are the business models I'm most interested in.
Yeah. That actually brings us back to the very interesting questions we have been talking with you about earlier. Is about the question of responsibility, okay? So, if in healthcare, I will take responsibility of my health for myself, okay? As I'm thinking about it. So, in the sick care, I'm kind of expecting someone to help me later, the problems that I'm accumulating. And, here in Europe, we generally discuss about societal missions and how the science would solve the societal missions has been one of them, right? So, and what you do, if you work in with creative destruction lab and what you tell me about the healthcare and sick care relation, then you also say that we should take ourselves more responsibility. So kind of, how do you see that contradiction of state versus personal responsibility?
So I think it's very important to think about how you build what I'm going to call participative models. Mm-hmm. So alongside my work in healthcare, I'm very active in public education in the United States, and I'm a founder of something called Summit Schools, which is the largest technology-enabled education platform in the U.S. We're in every state in thousands of schools. And in that model, you ask the student to take charge of their own education. And so it's a child-centered learning platform as opposed to a teacher-centered education platform. So that's a fundamental difference. And by the way, the outcome effects are staggeringly good in terms of how much better young people do and how much more well-equipped they are to enter the adult world if you make the model of learning about participation and self-driving and self-autonomous. So the same needs to apply in health. We're going to overwhelm ourselves with sick care bills if we don't ask people to become accountable and responsible for their own well-being well before they get sick. And that shouldn't be a particularly difficult burden if we provide people with the expectations and the tools and the resources to make that happen. So I'm a strong believer in participative models. I'm not a believer in the nanny state.
Right. So, actually, what you were telling, this is exactly what we feel here as well, because we want to engage young clients for taking care of their health. But now, coming back to the technology, so we basically have different technologies that could help us. We have health monitors that can match us for, sleep better, move more, have less stress because we have our monitors. So how do you see that, since globally we see that emerging markets also the healthcare expenditure move up, and they are also very keen on using technologies. So use the technology and all the technology-based startups and new ventures are part of the solution. Or is it more like a cultural thing we have to change, or something else?
So there's some very, very important points here just to pull on. So you make this point about healthcare expenditure going up. And indeed, the World Health Organization has said in the past that one of the main drivers of healthcare inflation is technology. So that's interesting, right? So technology and innovation drive healthcare costs. That's money. In every other industry, innovation is defined as faster, better, and cheaper. Apparently, in healthcare, innovation is called slower, the same, and a lot more expensive. Why is that? Well, that's because we're pulling the profit lever, we're not pulling the patient outcome lever. So this definition of what innovation is must change because innovation has to drive better outcomes at lower costs. That's what it means in every other sector. Just think about electronics, cars, food, everything. Okay, so that's the first thing. The second thing is we've got to think of much more effective ways of doing healthcare accounting at the national level, because health ministers are loathed by prime ministers. It's because when they walk in, all they ask for is more money. And the prime ministers worry because even though they get more money, nothing seems to change because of the financial model that we've now allowed to promote itself. So health is wealth. If you think about, for example, a financial model that underpins environmental spending, nobody says, oh my God, what will it cost to contain global warming? Because we all know what the benefit is. So why do we never do cost-benefit analysis in healthcare? It's always only cost. So we need much better structural accounting methodologies. And then the last point that you raised is, well, are consumer technologies part of the solution to better healthcare? Yes, they are, but they need to be designed in ways that are extremely consumer-centric, and they make it easy for consumers to use things. The analog I'm going to use for you here is the tech industry. Most people who own a mobile phone make less than $10 a day. Most of those people have no access to healthcare whatsoever, and they're using sophisticated computing devices that have been exquisitely designed by the tech industry so that ordinary folks everywhere in the world can use them and get great outcomes when they want to communicate and use computers. That's the kind of business model and design approach that needs to happen in healthcare.
Mm-hmm. Yes. You have actually, I totally agree with you. And a couple of weeks you were here in Portland, we discussed about our future cooperation and the possibilities to do it also here in Delta. So what do you think? You are a long-term friend of Estonia in general. So if you look at the comparison between Estonia and perhaps other countries, can you see any difference in our health behavior or our health industry or our health startup scene? You can compare the U.S. or...
So you have a very vibrant economy, it's very forward-looking, it's very digital. One of the most important things about Estonia that makes it a very interesting place to do new things is that you don't have a lot of incumbents. And so, in particular, in the context of healthcare, because it's such a regulated industry, for new technologies to find their ways into the marketplace at scale, you need, in many cases, for regulations to change. When that happens, the politicians all go and talk to the incumbents, and they all say no, because they've got massive financial interests associated with the way they do things now. So, for example, I live in the Bay Area. Stanford University has the largest health system where we live. They've scattered this area with 60 multi-billion-dollar buildings full of their expensive people where they make money delivering extremely expensive products. They have no interest in shifting their building people product model into a mobile software service model, and they'll fight it like crazy, and they'll fight people being paid for those kinds of tools and services. Okay, in Estonia, you don't quite have that problem, and that creates a real opportunity. I'll make one other point about the Delta building and what I've seen there so far. I talked about the tech model and how it's become exquisitely consumer-centric, which, by the way, is a choice. It's a business model choice. They've done three things. Consumerize, so we focus on the consumer, not the professional. More computing power owned by individuals than by governments and corporations combined. That's a fundamental shift. Consumerize. Okay, the second thing is systematize. So when people think about an iPhone, they imagine that it's an Apple product, but actually not. It's a genius combination of Apple, Intel, Microsoft, Google, you name it. Every single one of the tech companies is inside that seamless consumer experience that's delivered by, quote, Apple. So consumerized, systematized, and then the third thing, and this is also really important, is globalized. The tech industry sells to everybody in every country in the world, and they tailor their products to make them affordable to poor people. In healthcare, we principally sell only to the richest people in the richest country in the world. Okay, so very different business models. If we're working in Australia in a place like the Delta Building, that's a multidisciplinary center with many different folks all coming together, then the one thing that I'm going to suggest that we do when we develop new healthcare products is consumerize, systematize, and globalize. Those three things.
Right. Thank you for these tips for us. And we will actually continue our conversations in another time. But thank you, Andrew, very much for joining us. It was sorry for some technical issues, but it was a lovely talk, and let us meet another time, right?
Thank you, Gary. I'm looking forward to it. I hope that was fun for everybody.
Yes, I hope too. And have a lovely morning. Okay, thank you.